Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to add one more case to this TMJ problem. And this lady in California who called is having this pain for about 20 some odd years, she tells me, and I hope she is able to look at these videos. So I'm trying to answer her questions and everything through videos. That's what I'm going to try to show this. I've got about 10 or 15 women that we did TMJ problems on. Each one of them has a different reason for it to start, but all of them go back and they're causing something that irritates the jaw joint, the retrodiscal tissue, where it's got the condyle banging into it every time they swallow, and that's what causes the problem. Now I'm going to have to go through this lady just as real fast. If you want to go through it slower, and you can slow it down and look at it how you want to. And she looks like she had teeth extracted, but we never took any of her teeth out. She looks like somebody has taken all of them out here. And a very nice lady. She worked for my son quite a while, and has been a very good dental assistant and worked for several years for us. This is 1990, and this is she is. But here it looks like somebody has extracted her teeth rather than the fullness in there. But we've taken no teeth out. But she's got a problem for TMJ. Now this was a totally different problem for the lady before, but she's got a closed bite. You don't even see her bottom teeth under here. So her jaw wants to come out forward of that, and if you got these teeth up out of the way and got them out front and let the lower jaw come out where it wants to, that'll solve the TMJ problem in her case. So we're going to have to open the bite, tilt the teeth up, and let the jaw come forward like this, and that'll let the bottom jaw come out in that way, and that'll solve the TMJ problem. So there'll be separate causes for different people like that, but the same pain is coming from the TMJ problem. All right, we've got it separated back here. We're going to put the braces on there, and we'll go through this, and we're going to angle these teeth out, and line them up out here further, and let the jaw follow it out. And here's where the lower anterior were crowded up. They were pushing up underneath here, and they were all crowded. And we're not going to take any teeth out on her, because she certainly doesn't need any reduction of the profile out there. So now we put intruding arches. You see this wire right here? It goes down and comes over here, raise it up. You run a flexible wire in here to line the teeth up. And now this is pushing down on the teeth, and it'll push this up. It'll open the bite to some extent like that. And we'll take this arch wire, probably we may have had a opening 1, 2 here and brought it down, and now we've got it up, and we've got a rectangular wire in the front part of the mouth bringing that out. So we're going to open this bite, and then now you can bring the teeth forward, or a lot of times just you get the teeth out of the way and they'll just move out there. But you may not bring them just exactly right, so you use elastics, to fix it up correctly. And in her case, we opened it up like that. Now you can come in and treat TMJ cases sometimes, but it's how you move the teeth around and get them out of the way. And now we've lowered these lower teeth down, and we've got a rectangular mouth and this over here, and that's lining them up. Now we used a funny type of headgear. It goes across the forehead right up here. These little pads fit on the extensions right here under the eye, under the maxillary sinuses up here, and you come back, it pivots over here and it pulls the upper teeth in a forward direction. It brings them out and let the jaw follow that. Now this is not too, it makes these bone structure up here, it hurts. It really, this pad would have to be over like that when you get it, and you pull back through here with the elastics, just go through the lips where they come together, and that advances the maxilla without pushing back on the chin. Now, if you want, you can take and use class 3 elastics. You pull the jaw forward. In other words, you're going to pull the upper teeth in a forward direction right here, well, coming back and using the elastics from the top to the bottom front, and that pulls this out, but it pulls back on the mandible and pushes the condyle back into the fossil sometimes, and you can't use that. This headgear, if you used it, it would not push anything back into the jaw joint, but it's hard on the face. Now this wraps around the head and holds this up here, and it pivots off of this right here, and you bring this back in there. The idea is good, but it puts a lot of force on this bone structure up here, and that irritates some people. All right, now here we're opening the bite. This is the intruding arch, which will bring this down. It kind of picks this up back here at the back and levels this out, so this is fitting correct. But that was the reason for her TMJ problem. This lower jaw wanted to come out and it couldn't because these teeth were in the way of it. Now how it got there, that's hard to figure out how it did. But here we leveled it out, we bring that out, we put a ramp deal in there, and I'm going to go through this fast. We have this lady on another video, but since we're trying to help this woman, now she's 30 years old at this point, 31 months, and this was 1990, and we opened that up like that, and that's 93, and there's where her teeth ended up at here, and that let the lower jaw come forward right here and fit in a class 1 relationship. And this is 90, and it's class 1 on one side, it's class 2 over on this side, and we've got to bring it around at an angle like that, and the teeth are closed down here, and the bottom ones come up there like that. So we come in and didn't have to raise the upper too much, and we did lower the lower. Now here, now we're biting on a bite plate we've got in there, and we opened it up, and this is the transcranial x-rays, and you can see where the condyle, where they bit down and they relaxed, and it opens. I don't even see where it opens in here. But anyway, I'm running through this real fast. Now we looked, you can take the models and shoot from the back side. The lower teeth were up in here around the jaw. It was where it's crooked and everything. So we're bringing these lower teeth down, and the force that comes at is raising these teeth up right here. You always have an equal and opposite force like that. And so we bring these down. Now it's closed right here, and we'll show you that it's closed again. Now there we opened it, and it came up like that. So we brought these teeth down, and these, the archway probably picked it up to some extent, and here we're finishing it up, and it looks like she had teeth extracted, but we did not take any teeth out. We open this, we're going to bring those teeth. This is okay right here. and it's more the lower teeth have gone up underneath the upper teeth is one thing. So that's 1990, and there it is, 1993. And when we did that, this jaw quit hurting. In other words, this was class 2 on one side, we bring this down. So we brought this on one side around here, and the other side was pretty well corrected. Let me see if I can go back over there. So it was pretty much class 1. So we had to twist the jaw like that to get that in there. Now you can't do that stuff with these plastic deals. It will not allow you to twist this like that. In other words, you got to play one guy against the other. You're pulling back here, and you're pulling this back and this forward on this side, and you may have to come across the front from some midline elastic to get that to do that. And now we're going to actually just straighten these teeth out, brought them up, and then these will bring down quite a bit and picks this up and opens the bite. And there it is in 1990, and there it is in 1993. In other words, this tooth moved from where it was back, this point was back in here. Let me go back and show you where it was, the cusp is hitting way back here. This molar was even with that. When we bring it out here into class 1, the bottom molar now is out in front of the upper molar, and that's the way it's supposed to be. And she got contact with it. And so we take her out of this, and there we were in 90, and there we were in 90 in the mouth. And now you see these teeth are laying out further, laying out there, and that freed the bottom jaw up and intruded that. And now we put a retainer in her mouth, and I put a ramp here so she wears that retainer and keeps those teeth in that position and doesn't let this deepen again. And now these teeth were crowded here. We didn't need it. We took them down and gave them more space here, and that was able to move forward. And in other words, got the teeth out of the way here, and now it moved out here, and that takes care. It gets the condyle off of that retrodiscal tissue, and that's the thing you've got to do. All of them were hurting back here, but they had, all of these ladies had some reason for this jaw to be like that. And this is what her reason is here. So we push that down, and now we line those up, and we bonded this and bonded all these to make sure they stayed that way. And I assume they did, because we followed this young lady for years, and it never did relapse again back to there. And here she is later on with the teeth that meet correctly, and the TMJ problem is gone. But the teeth, her facial structure, she's a nice looking lady, even though this is in some. And somebody would look at that like that and say, well, somebody took some teeth out on her, but they didn't. All right, there she is later on. And this is 04. In other words, we show this back here was 90. That was 90. And then that's 93. Now this is 11 years later. They're right here. She's chewed the front teeth, they're just ground flat. But it has stayed there. That's 11 years after we finished her work. And this is 8/6 of 04. And it's there. And I've kept up with her over the years, and her teeth have stayed there. This broke loose in here, but it's bonded real good on the inside, and that stayed. And she had to take a floss and do that, kept those teeth in that position. That's all right. I'm going to say goodbye, and I hope you'll join our group. But you see, there's different things that cause the problem, but the problem is pressure and pushing into that retrodiscal tissue that's supplying the food and the lubricant for the jaw joint. So I thank you, and I'm going to try to see if we can put another one up here, and I'll say good.